Hi, welcome to Health Educated's Keeping It 100. I am your host, Dr. Kristen Ball Motley. So, as you know, our show premiered last Wednesday evening, and it was a really good show. And people enjoyed it, and I enjoyed it. And I was thinking about doing it once every other week in the evenings, but we decided to keep the party going. So we're going to be on here every week, Wednesdays during the lunch break. So I could take a lunch break. Y'all can take a lunch break, come through and live a little healthier life. So today we are going to be talking about the test and treat program that President Biden announced at the State of the Union address last week. He said that he's going to be launching this program where you can go get tested for COVID at a local pharmacy and get a COVID pill if you test positive. This is what he's calling the test and treat model. And the drug that you would get is called Paxlovid. It's made by Pfizer, and it's been shown to be about 89% effective in keeping high risk people from developing severe COVID and death as long as it's given within 5 days of having the symptoms. Now, this drug is approved through an EUA, an emergency use authorization, which we mostly heard about when the COVID vaccines became available. These are governed by the FDA, and they are issued when there is an urgent need to treat or to test a health condition like COVID. And they need to get this approved and through before the FDA has time to do a full review of the data available. A field review usually takes months to complete, and with diseases like COVID, we just don't have that time. So the EUA is approved for the vaccines, although Pfizer's vaccine has been fully approved, but the Moderna and the Johnson are still both operating through the EUA. And this new pill that is available is also available through an EUA. So I have a special guest. I'm going to always have a special guest because I don't know everything. And so I'm always going to lean on my friends and my colleagues who are in the top of their field to come on and help to educate me and to help educate you on whatever topic we're discussing. So I'm bringing in Dr. Renee Jones. She's a pharmacist and the director of pharmacy and case management at Personal Physician Care based in South Florida. Most importantly, she is my best friend from FAMU. We went to college together, so I know what she knows. She knows what I know. And she was actually my tutor in school too. She's really, really, really smart. So when I came up with this topic, I knew she would be perfect because she travels around the country educating pharmacists on the new drugs for that year. So I couldn't think of anyone better to lead us through this conversation. I also want to mention that Dr. Justin Foster, he is behind the scenes with us, helping us to find answers and information if y'all ask some really, really hard questions. So he'll be behind the scenes today. But hi, Ren.
Hi. Hello, Dr. Motley. How are you?
Welcome to the show.
Thank you. Thank you for having me.
Yeah. So, I called you last week, asked you to come on so that we can talk about this. I can learn about it and we can educate our people because they have a decision to make now. So, people that
Yeah.
haven't been vaccinated, they if they test positive, they may want to do this, take this new drug that's available. So let's talk about it a little bit.
Sure.
Paxlovid. What kind of medicine is it? What does it do? Like, how does it work?
Well, Paxlovid is actually a medication that stops the virus from being able to replicate. And so if it can't replicate, then it can't cause severe or mild infections. It actually is two medications in one pill. Oh, actually two medications given in three pills. I apologize. And so you have to take three pills by mouth twice a day for 5 days.
So it stops the virus from replicating. Okay. Um, so I guess my next question would be, so who is like the ideal person? I mean, I imagine I'm young and healthy, and if I test positive for COVID, I don't have any coexisting diseases.
I understand.
So like, is there, is this something for just say anyone who tests positive for COVID, or how does it work?
I understand. So actually, when they were first studying this medication, Paxlovid, they only used it in patients that were not previously vaccinated and did not have COVID in the past. So that's number one. Number two, all of the patients had to have at least one chronic disease, whether that could be diabetes, anything related to the heart, congestive heart failure, atrial fibrillation. Um, Multiple disease states. But if you look along the package insert for these patients that they tested it on, they could have a mechanical device, etc., or they could just be over 60 years of age without a chronic disease. So in your instance, they really didn't test it on you because you're less than 60 and you're a healthy adult. They have approved it, however, for pediatric patients greater than 12 years of age and weighing at least 88, 90 pounds. However, it is important to note for those of you that have children, if you have not vaccinated your child and you are considering this medication for your 12, 13-year-old child, please note that they have not studied it in the pediatric population. It was only studied in patients greater than 18 years of age. And what they've done is they're speculating that based on age, weight, height, patients that are greater than 12 years of age or 90 pounds should respond to the medication just like adults.
Wait a minute, that was a lot.
Yes, it
So
was.
let me go back. It was studied in people who have never had COVID and
Yes,
who are not vaccinated,
correct.
and only in adults who are 18 years and older.
Correct. Again, 18 to 59, they had one comorbidity, one chronic disease. Even if they were a smoker, even if they had high blood pressure, they were allowed to be studied. But once they hit 60 years of age, they didn't have to have anything, and they were studied as well.
Oh, okay. So as long as they were over 60, they didn't have to have a comorbidity.
Correct. Which is unlikely nowadays, unfortunately.
That's true. Yeah.
Again, because they said high blood pressure, that kind of is like most of our population nowadays. Diabetes, if you're overweight, they included that as a chronic disease to allow you to be a part of the trial.
Now I'm I'm wondering if they didn't study it, if they didn't include. I mean, how could it be an EUA for 12 to 17 if it wasn't studied in that population? I would imagine they must have had some data, right?
Yeah, for approval, they did not. That's not to say that studies aren't going on at this
Yeah,
moment.
yeah.
And for emergency use of medications, normally we would never do that, especially with our children. We make sure that the medication has been studied. Even with the COVID vaccine, there was studies ongoing with children, real-time studies, obviously, before they allowed it to be used in the general population. But because it's an emergency use medication, they did approve it just based on how adults and children of that age metabolize or excrete these particular medications. But no, it has not been studied in children.
That's very interesting. But we don't
Yes,
have
it
the data
is.
yet. So hopefully they get that data out soon just to make sure that it really is as safe and
Yeah.
effective as they anticipate it to be. All right.
Yes.
So it sounds like they're looking for people who are at high risk for having hospitalization
Well,
or death.
so technically, that's how the vaccine started. They were targeting the elderly, people that had these chronic diseases that their body wouldn't be able to really handle having COVID. But now they are not what we consider detrimental chronic diseases, I'm not going to look at someone that has high blood pressure, but they take their medications every day, so their blood pressure is now normal. That
Mm-hmm.
wouldn't be someone that I would be considering an at-risk patient, but it is still a chronic disease
Mm-hmm.
that people have. It is a silent killer. So they kind of included everything except for like mental health, to be honest with you. If you're
Mm-hmm.
active smoker, sickle cell disease is prominent in the African American community.
Mm-hmm.
Overweight obviously is a prominent in our community, so that's who they targeted.
Okay. And again, they also included people who have not yet been vaccinated. So
Correct.
is it only supposed to be used in people that haven't been
No,
vaccinated? It can
anyone
be
can
used.
use it, but
Okay.
that's what this initial study focused on.
Okay.
There's no data yet on if it's superior, the same, or anything once you have COVID.
Okay. Now, how long has this drug been studied? Because a lot of the controversy around the COVID-19 vaccines, when it first came out, it was new. And I wasn't trying to get it. And I know you wasn't trying to get it.
Nope.
We was like, we
And
going
what
to
pharmacist?
wait this out and we'll see what happens. Because this is
That's exactly what we said on the phone. We're going to see what happens to everybody else, and then we'll make a decision. And that's funny coming from two pharmacists, because I had most of my physicians in the office, they're like, you still haven't gotten it, you still haven't gotten it. But, sometimes there's a scenario where you know too much. So we kind of just wanted to see what was going to happen. With this medication, we're going to have to see what happens, because it was just actually brought onto research in about June 2000, excuse me, June 2020. That's when it was began the studies. So it hasn't even been a full 2 years yet. And not to persuade you or dissuade you from taking Paxlovid, but to just let you know that most of the time it takes quite some years for us to study medications. We study them from the kinetic standpoint, meaning we study, how is this medication chemically formulated? Then we go on to rats. Then we go on to human trials for people that are normally healthy, just to see if it's safe. And then we go on to our trials to see if it's effective, if it actually works. So when Dr. Motley mentioned that there was an emergency approval for this drug, what we're saying is we're kind of bypassing all those years and steps, and tangling it all up into like one trial with humans. Let's see if it works. Let's see if it doesn't. Let's see if it's safe. Let's see if it's not. And they did that in about 2,200 patients. Many clinical trials that you see for medications that are not being used for emergency use, you have trials of like 10,000, 20,000 patients or more. This particular trial only had 2,200 patients in it, which is not a lot compared to the millions of Americans living in the US. So we're going to have to wait and see.
Okay, definitely. So I want to back up again. You said two important things. So one is this drug was discovered, I guess, about a year and a half ago, um, and so that means it really is like new.
New.
New. When we're talking about the vaccines and using the mRNA technology, I think that the media did a lot to call it new, which scared people like us.
Yeah.
Like, I don't want no new drug. I don't want no new vaccine. I don't want no new nothing. But what we actually had to learn about was that the technology that was used for that vaccine was not new. It was a new vaccine for COVID because COVID was a new disease. But the mRNA technology that was used to create the Pfizer and the Moderna vaccine was actually not new. It had been studied for decades. And so learning that helped to bring comfort to me.
Yeah.
How about you?
It actually did. When I found out about the mRNA vaccine and how long they've been studying it, I was, to be honest, happy that that research had been going on for so long, so
Yeah.
that I could feel more comfortable taking this medication, this vaccination,
Hmm.
compared to a vaccine that was just,
Hmm.
invented, 2 years ago. And people are right to have that concern, because
Hmm.
it is a vaccine. It is injected into you. It is altering the way your body is perceiving, new viruses. That's why you have this antibody effect or can fight it. Um,
Hmm.
and a lot of people feel comfortable taking pills. because they have a notion if I take it, it'll go out faster. I won't have any long term effects. So there's both sides of the coin with comfortability. But don't forget, all these medications also have side effects that we want to make sure, or at least we're aware of before taking these medications.
That's a big deal, and we're going to get to the side effects as well. I just want to mention that Justin found some information about COVID, about Pfizer starting trials for the Paxlovid in 6 to 17-year-old
Yeah.
patients. And it looks like they have one study that has 140 patients, pediatric patients between the ages of 6 and 17 so far. So
That's
they're
wonderful.
looking at the data, which is really important, but I like to see the results of the data,
Yeah.
lots of it.
A lot. Because especially for those of us that have kids,
Yeah.
personally, I had vaccinated my 16-year-old son before I even got vaccinated. And the reason was because he was just diagnosed with type 1 diabetes in May. It was a scary situation. He was in the ICU. And I chose to have my son vaccinated immediately after we were discharged because COVID is real. And even now, you have various states that are releasing the laws or removing the laws that required masks and things of that nature. But COVID is still here,
Mm-hmm.
and so protecting him was, in my eyes, the best way to do it by vaccinating him to at least reduce his severity of the disease should he get it, which he did, and not cause hospitalization or worse.
Mm-hmm. Mm-hmm. Yeah. So it's good that you looked at his risk and said, oh, now he has a risk factor. He's at high risk.
Yes,
He has diabetes. He needs to get vaccinated.
correct.
So that makes a whole lot of sense. Now I want to talk a little bit about Black people involved in the clinical trials. A lot of times we're looking at the trial data, or and we are often wondering, were there Black people included, because we want to know
We're
what
there.
happened in them so we can figure out, is it going to help us too? So do you know about how many people were included in Pfizer's trial for this?
Yes, so out of the 2,200 on average patients, about 5% of the patients were of African American descent.
Okay. So 2,200 patients studied, 5% were Black. And then when you look at the COVID vaccines,
That's actually 110 African Americans out of the 2,200 patients.
okay. So 110 people, which accounted for about 5% of
Yeah,
5% of the total population
correct.
who of the study participants.
Yes.
Okay. All right, cool. So I wanted just to compare that to the percentage of Black people that participated in the vaccine clinical trials. Um, I know that there were so many people. So if you look at the trial for Paxlovid, it was 2,200 people. When you look at the clinical trials for the vaccines, Moderna had and I don't know these numbers off the top of my head, but it was a lot. It was like, I don't know, 20 or 30,000 people.
Yeah.
If, Pfizer had the same 20 or 30,000 people. So they have like tens of thousands of people in the studies. The pill has 2,200, like 2,000 people in the study. And the vaccine trials had about 10%. I think it was 10% or more of the population was Black. So twice as many as were involved in compared to the pills
Yes.
study. So many more people in general, so many more Black people. And so if you're considering what information we have and the the data that's available, is more Black people in the vaccine trials, and it's more people in general, many more people in general. So I want us to start to think about things like that, so it's not just I'm not getting it or I don't want to do it because it's not enough information. Now we have something to compare it to, because now you can look at the pill or you can look at the vaccine. And when you compare them to each other, there's more information on the vaccine than there is for the pill. And it's nothing wrong with that. That is what it is, but it can help you to guide which one, if you had to pick one or the other, which one would you feel more comfortable doing if you care about what the science is. So
That's
just because,
absolutely correct. I want to add lib to that. So, comparing the side effects, if you will, with this new medication, which right now from what the data shows of those 2,200 patients is limited. Maybe 1% of the patients might have high blood pressure. 3% of the patients might have some diarrhea or stomach aches. Only 1% had some muscle aches when they took Paxlovid. But remember that that was a very small group of people. So the more and more patients that they test, the more that they give the medication to, the more amount of patients you're going to see with side effects, or it could stay the same. But the thing is that we just don't know. With the COVID vaccines, we do know. And that's one of the reasons why people were hesitant in the beginning when they were getting the vaccines, or at least offering them. We found out later that Johnson and Johnson had some issues with the clots that it caused, and so we backed away from that vaccine. And that was over time and over more patients that we found out this information. We really haven't had that time with this new medication, Paxlovid, at all yet.
yep, it's true. And I'm glad that you brought up the side effects, because when you look at the side effects of the pill, um, it's way more common than the, say, side effects of the vaccine. So I looked at a study that highlighted how often did people report the, say, side effects of the vaccines. And again, these numbers are going to be low because this is what people reported themselves or with their healthcare providers reported. So they're low, but it's still good to know what were people saying and how they were feeling.
Yeah.
So when we looked at, and this was a study that was done from January 1st to April 30th of 2021. This is from last year. So when you look at the common side effects reported from the vaccines, it was headache, chills, fever, and pain at the injection site. For a lot of those, the frequency was 0.1% to 0. To 0.1%. Super, super low.
I believe that.
0.01% to 0.1%. That's very, very low. And this is studying 240 million doses. 240 million doses, and headache happened in 0.01%. That's like it didn't happen really. But again, this is probably, say, underreported, because these are, people have to go into the system and report it, and it's paperwork and it's time and technology. And if you don't have access to time or computers or paperwork to submit to the VAERS system, it's not captured. But generally speaking, the side effects of the vaccines have been very, very mild. And the extreme side effects, like the allergic reaction or the clot, has been very, very, very rare. So take that into consideration too. Did you have something to add, Dr. Jones?
No, not at all. I actually have a funny story about that. Because we're not reporting it as as much as we would hope to, you can actually ask your friends and family that have gotten the vaccine, like, how was it? Use them as a reference. Some people might say that they were tired, or they felt achy. Some people, like my daughter, she's 9. She got the vaccine, and I told her when I got it, my arm hurt. So the first day, she was like, "Oh my gosh, I can't move my arm. I need help." And then like we got home, and 20 minutes later, she's like playing tennis. So what happened to your arm? Oh, it stopped. So the side effects of the vaccine are nothing that me as a pharmacist is concerned with when compared to the risk of actually acquiring COVID, and what can happen. Remember, COVID is not just something that can affect me personally or you personally, but it also affects the loved ones around you that you come in contact with. When we go home, we tend to take off our masks. We can't wait. And now we're exposing those people. So the vaccine definitely has been studied, and the side effects are minimal.
Thanks for sharing. Jazzy funny. She said, "I
Yes.
can't move my arm."
Phew. Like, how we brush my teeth. Get out of here.
She funny. She funny. So, I want to go back to drug interactions. So that's a big deal. So, do we worry about drug interactions with the vaccines at all? I don't ever remember it being a thing.
Actually, we'd only worry about vaccines when we're giving them with other vaccines. You can't give
That's
certain
true.
vaccines at the same
Yeah,
time.
that's true.
But other than that, we vaccinate everyone. Um, as long as it's age appropriate and dosed appropriately, there's no drug interactions. The same cannot be said for Paxlovid, though. It does have some interactions, and before you go, to just freely get this prescription, especially from an urgent care or something like that, you want to make sure that the person knows which medications you are on. There's certain medications that you can take this medication, Paxlovid, and it'll cause your other medications concentrations to go really high. And that can cause side effects. Some of those medications, for example, are Xanax. Some people use that for anxiety or to calm down. Um, that would make your Xanax dose feel like got a lot larger dose. And you don't want the side effects from that. Some people on heart medications, they're on blood thinners like Eliquis or Xarelto. They can make those medications work too well and cause a bleeding issue. So you definitely want to know about the side effects or about the drug interactions, and talk to your pharmacist or your doctor.
Good point. So again, um, these are things that we want you to always be considering when you are deciding what to do, how to keep yourself healthy, if you want the vaccine, if you want the pill. We're just trying to give you some things to consider so that you can make the best decision for yourself. I saw that Lakeisha had a question that popped up on the screen, but I didn't get a chance to read the question. Can we bring that question back? And I also wanted to mention that Justin had wanted us to clarify that patients that take biologics like monoclonal antibodies should avoid taking live say vaccines, which is very true. So then I guess that is like a drug interaction to
Yeah.
a vaccine, but the COVID vaccines are not live vaccines. And we could talk about live and dead vaccines on another show. We almost out of time, and I'm waiting to see Lakeisha question. All right. So we're gonna move along, see if I get it popped up, and if not, girl, I'm gonna just try to call you.
Hi,
um,
Asia.
okay. Would you recommend consulting with your medical provider prior to vaccinating? Oh, absolutely,
Yes.
absolutely. Especially if you trust your healthcare provider, always, talk to him or her about the healthcare decisions that you're making. Help them to let you weigh what's the best thing because they know you and they know your medical history and all the
Yeah.
medications you're taking. So absolutely do that. So I guess just to close out,
Can I
Dr.
mention
Jones.
one more thing
Oh
before
yeah.
I did forget? probably the most important thing, if you do choose to take Paxlovid, one of the things you have to remember is that you have to take it within 5 days of your symptom onset. So if you miss that window, there's no data on if it works anymore at all. So that's one of the things that you have to be concerned about with the pill. Some people, when we feel like we have a little runny nose or something, we kind of just ignore it. But that could be an onset of your symptoms if you, God forbid, got COVID.
Thanks for adding that. Thanks for adding that. So I was just going to ask you, so just kind of looking at what you know about the pill and what you know about the vaccine in general, if you were going to talk to someone who had not been vaccinated yet, what would you say about them getting the pill versus the vaccine?
Well, if they truly wanted to choose one of the two options, I will tell them that I think it's safer for them to be vaccinated. There's multiple reasons, one of which you brought up: the length of time it's been studied, the number of patients that's been studied, the way it's been studied in African Americans compared to the pill formulation of it. But also that you're being proactive. So you are, in essence, if you are exposed to COVID, you know that for the most of the mutations that we know of thus far, at least most, it does protect us against contracting the virus and spreading it to our loved ones. The rate of spreading it once you're vaccinated is extremely low compared to if you wait until you get COVID and then spread it and then take the medication to lower your risk of hospitalization or severe infection. So I would always recommend the vaccine first. Again, there's things that are occurring on a day-to-day basis. Right now, the Florida General Surgeon is not recommending the vaccine for children between 5 and 12 years old. We're waiting to see what science that goes off of. But if you had to choose one, I would definitely choose the vaccinated approach.
Well, thanks for coming on the show today.
Thank you so much for having me. I greatly appreciate it. I see my best friend. Hi.
I know I don't get to see you. You're all the way down south. We'll be back one of these days.
Yes.
All right, y'all. Thanks for tuning in. We will see you next Wednesday at 12:15.
Thank you for having me.
All right, bye.
Bye bye.